Hello, can you hear me, please?
Hello, can you hear me, sir?
I can hear you, but can you hear me? Can you hear me?
Hello, good evening, sir.
Can you hear me, please?
Hello, sir.
Yeah, good evening. Can you hear me? Am I loud enough?
We can hear you, sir. We are live, sir. Good evening,
Oh,
sir.
good evening. Thank you.
Good evening, everyone. Good evening, our viewers. Thank you for joining this evening. So this evening we'll be talking about some health insights on hypertension. So with us this evening, we have Dr. Masha Gusen, the family physician in Just University Teaching Hospital, and he'll be our guest for this evening, and he'll be taking us through what hypertension is all about, what hypertension is about, how we can prevent hypertension, and how to manage hypertension as well. So I'll be asking Dr. Mashak some questions right now. Before we proceed, I would like us to know that this live video is brought to us by Complete Care. Complete Care is a digital marketplace where patients connect with doctors and get to consult online. So I'll be starting this evening by asking Dr. Mashak some questions. So, welcome, Dr. Mashak. Thank you for joining us.
Thank you very much. Good evening, viewers.
Good evening, sir. So, I'll be asking Dr. Mashak. So, this year's World Hypertension Day theme was measure your blood pressure accurately, control heat, and live longer. So, I would like to ask, what is the significance of the day and the theme of this year's event, sir?
Okay, thank you very much for having me on this platform.
Sir?
The World Hypertension League has set aside 17th of May yearly, especially this year, 17th of May 2024, was set aside to commemorate the fight against hypertension, which is a silent yet killer disease of numerous individuals in the world, not only in Nigeria. Okay. The significance of this day is one to galvanize global action against hypertension by encouraging people to check their blood pressure daily. Also, to educate and inform people about the dangers of uncontrolled hypertension, as well as promote lifestyle changes and intervention that promote and control hypertension. Okay, so this is why the theme of this year was carefully coined: measure your blood pressure accurately, control it, and live longer. Thank you.
Okay, thank you very much for that answer, sir. So
Thank
I'll
you.
be moving on to our next question now, um, which says, okay, so many of us hear about the term hypertension without truly knowing what it means. So, what really is hypertension and what causes hypertension, sir?
Okay, thank you for that question. Hypertension is one of the non-communicable diseases, okay, in the world.
Okay.
Okay, it is the leading risk factor for disability and death globally. Okay, um, hypertension is defined as a blood pressure of at least 140 millimeter of mercury systolic blood pressure, or 90 and above millimeter of mercury of the diastolic pressure, taken on two occasions at least 4 hours apart. All right. Now, the pressure, as we usually write, is a fraction. The numerator is the systolic blood pressure, while the denominator is the diastolic blood pressure.
Okay.
Okay, it can be measured either at rest or when a person is, on activity, or what we usually call ambulatory blood pressure monitoring. Okay, now the systolic blood pressure is a pressure generated as a result of that contractile action of the heart to pump out blood. Okay, while the diastolic blood pressure is a pressure in the arteries when the heart relaxes to get filled with blood. So these are the pressures that we usually check to tell us whether the patient is hypertensive if
Mm,
there is more than 140 or 90 millimeter of mercury of the systolic and the diastolic blood pressure. Okay. Um, Having said that, hypertension has high prevalence globally and also in Nigeria. Okay, we are talking about how to measure one's blood pressure and live longer. Okay, why? Because there is low control rate of hypertension, and there are also numerous complications or cardiovascular complications of this hypertension, leading to the death of many Nigerians. Um, it is not surprising. It is estimated that about 1 in 3 Nigerian adults are hypertensive. That is quite significant. And at least 20%, or in another study, 20%, at least 20% of Nigerian adults are hypertensive. It is largely underdiagnosed. Okay. Interestingly, again, about half of those with hypertension have not been diagnosed, or they are either unaware of it. All right. And then um, only half of those with hypertension are actually on treatment. And again, only half of those on treatment are actually controlled or have their blood pressure controlled. Okay. Now, going to the causes, generally, um, hypertension in majority of cases has no known cause in most people, and this is called the essential or primary hypertension. While in just about 5%, 2 to 5% of cases, the cause is known. Okay, and we refer to that as secondary hypertension. So, having said that, it is important that we know that even though there is no particular single causative factor, there are risk factors associated with hypertension. Okay, these are broadly classified or categorized into two. We have the modifiable risk factors and the non-modifiable risk factors. Now, what this means is that for risk factors that are non-modifiable, there's nothing we can do about them. They're they're sticking with us. They're stuck with us. We cannot change anything. We cannot do anything about them. Okay. However, those modifiable risk factors are those risk factors that there's something that can be done about them to reduce our risks of having hypertension. Okay. Now, those modifiable risk factors, those risk factors we can do something about, include obesity, physical inactivity or sedentary lifestyle. We have some unhealthy dietary habits, insulin insensitivity, cigarette smoking, alcohol consumption are some of these modifiable factors. While the non modifiable factor age. It is known that the older we become, the likelihood of us having hypertension. Okay, this is because of the clogging of the blood vessels, thickening of these blood vessels as we grow, or due to deposition of some unhealthy substances within the bloodstream, narrowing the flow of blood, thereby increasing the pressure. Again, sex or gender, preferably, males are known to have higher prevalence of hypertension than women before women get to menopause. However, when a woman attains menopause or reaches menopause, her risks equates or even overshoots that of the male. Okay, so another one again is the family history of hypertension. Family history of hypertension. If my parents or any of uh, if my parents have hypertension, I am at risk of having hypertension just by virtue of being
Hereditary.
their child. Okay, then we have genetic factors as well. All right, genetic factors also play a role in the setting of hypertension. So these factors we can't really change them, we can modify them. They are just there with us. Okay, um, so that is that about what I can say now regarding the
All
question.
right. Thank you so much, Doc. Moving on to our next question. So, I would like to pivot a little and talk about pregnant women. There are women who develop, who even before pregnancy, they are not hypertensive, but during pregnancy, they develop hypertension during their pregnancy, but they don't have an history of this particular, like you said just now, you said it's hereditary, but they don't have this history of hypertension in their family. But during pregnancy, they develop hypertension. So, what could be the cause of this?
Okay, thank you for that question. Interestingly, uh, hypertension in pregnancy is actually seen as a complication of pregnancy. Okay, uh, be that as it may, um, hypertension can complicate pregnancy, and also pregnancy can complicate hypertension. In fact, um, hypertension during pregnancy is the most common medical complication of pregnancy. Okay. Uh, Again, there is no particular cause to say this is what is causing hypertension in a woman who is pregnant. Okay. However, just like we discussed above, there are risk factors associated with pregnancy related hypertension. There are again theories that tend to explain the dynamics of uh, what happens, you know, when a woman who is pregnant has hypertension. Again, genetic predisposition plays a role here. Okay, be it whether the mother has hypertension or the father has hypertension, it it is a risk factor that it's significant. Okay, there are other theories that try to explain um, reasons why a woman who is pregnant will have hypertension. When a woman has low level of placental growth factors, angiogenic
Okay.
factors, these attributes, or it's one of the attributing factors. Okay, when there are other oxidative stress, we call them, or vascular endothelial damage, what this means is that there are some things that happen within the vessel wall of the blood, of the blood channels in the body. Okay, that leads to some damages and eventually leads to hypertension. Another major factor here is defects or abnormal placental implantation. You know, when A woman is pregnant, the baby is already in the womb, the placenta begins to develop and embeds itself within the walls of the womb. Okay, so abnormality in this implantation can result in hypertension. Okay, um, other risk factors we've talked about earlier: a woman who has family history of hypertension in pregnancy is also at risk. Okay, a woman who is more than 40 years of age and she's pregnant or coming with pregnancy for the first time or even subsequent pregnancies, she can have hypertension. Okay, when there is a previous history that this woman had a condition called preeclampsia, um, she has she's pregnant and she has elevated blood pressure above uh, the defined level, and also she has protein in her urine rather. This could constitute preeclampsia, especially when it is occurring, you know, after 20 weeks of pregnancy. Again, nulliparity is another factor. Okay, when a woman has not given birth before, okay, and she's coming down with her first pregnancy, or when she's pregnant for the first time, or she has never had a child before, this would constitute risks that could lead to hypertension in pregnancy. Again, there are other conditions that also pose risks to a woman who is pregnant. If there's a pre existing history of diabetes, if this woman has an elevated body mass index, which means if she's overweight or she's obese, okay, there's a risk of her having hypertension in pregnancy. Again, there's a category of women who have hypertension before becoming pregnant. Okay, this one we call them chronic hypertension. They can have chronic hypertension and they can have superimposed preeclampsia on this hypertension. So these are the risks associated with women who are pregnant. Thank you.
All right, thank you so much, sis. So I would like to say to our viewers now. So please, if you have any questions that you'd like to ask Dr. Masha, please drop your question in the comment section. Then we'll pick it up from there. Then ask. I would like to ask. So how can an individual who has an history of hypertension in the family prevent hypertension?
Okay. Um, Thank you again. Prevention of hypertension is multifaceted. Okay. We can prevent primarily by trying to ensure that we enact laws or we advocate for laws that guide certain dietary products that we consume. Okay. An example would be ensuring that all processed foods that are sold in supermarkets or that go into the Nigerian market have a level of salt that is acceptable, that shouldn't be above a certain level, usually 5 grams per day. Okay, that's to quantify less than uh, uh, a level teaspoon of salt. Okay, again, we have to also factor other sources of food that the person will take during the day. So, if a person is going to take uh, a processed food that has, let's say, about 5 grams of salt in it, and then still take food with salt or with Maggi inside because Maggi too has salt, then it
Yeah.
means he's uh, exceeding the daily allowable requirement. Okay. Then we also need to advocate for policies that will control um, other food items such as fat containing diet and other dietary substances that would lead to increased blood sugar. Okay, um, to control that, for public consumption. Then we also have to talk about modifying lifestyle, diet, physical inactivity, uh, and also stopping or cessation of cigarette smoking, moderating alcohol consumption, or even stopping. Recently, WHO says there's no benefit of alcohol, whatever amount you take, there's no benefit to it. Okay. So when we're able to modify some of these lifestyle changes, we would improve and control hypertension. Physical activity, instead of eating, watching movie, sleeping, not exercising, we can begin to advise or counsel people to exercise, at least moderate, tolerable aerobic exercises, um, 30 minutes, at least 3, 4 times a week. Okay, that would improve and reduce the blood pressure to a great extent. Thank you.
All right. Um, Thank you so much, Doc. So
You're
before we
welcome.
proceed, I would like to let us know once again that this webinar, this live video is brought to us by Complete Care. Complete Care is a digital health marketplace that connects doctors and patients and other healthcare professionals within the shortest period of time possible. I would like to proceed now to our next question. Thank you, Doc, for the answers that you've given us so far. So I'd like to proceed now to ask us to know. Okay, we've been talking about hypertension, what hypertension is, how it's hereditary. So I'd like to know what are the symptoms of hypertension? How would someone know? How would I know as a person? How would anyone know as a person that okay, I think I have hypertension? What am I supposed to look out for to know that this is what this is?
Okay.
Thank you, sir.
Thank you very much for that question. It is important to say that if one would have to wait to experience a symptom of hypertension, the person may be late. Stroke may strike, heart attack or kidney failure may occur, and other complications of hypertension. So it is important to also note that in about 85% of cases, many patients or many people
We have
actually don't
symptoms.
have symptoms. They don't have symptoms. It's asymptomatic in most cases. Okay. Few individuals will experience headache, which may come in paroxysms. Some may experience palpitation. They will be feeling, their heart beating fast. Some may experience dizziness,
Not
some
speak.
chest pain. Some may even have altered vision. Okay, so these are common symptoms that a person with hypertension may present with. Okay, yeah. Now, having said this, if there are complications, depending on the organ or the part of the body with that complication or manifesting that complication, symptoms of such an organ would also show itself. All right. But basically, without complications, most patients are asymptomatic. The few that will present will have headache, dizziness, chest pain, or poor vision. Thank you.
All right. Thank you, sir. I have I have heard many people say they may suffer from hypertension since their parents or grandparents suffer from it. And I know you mentioned earlier that hypertension is hereditary. But is it possible that okay, it's hereditary? Your grandparents have it, your parents have it, but is it possible that I, as the grandchild or as the child now, I don't have it? How can I? Is it possible?
Yes, please. From what we have discussed earlier, you will agree with me now that hypertension is hereditary. Okay, it runs in families. It can be inherited. However, even if one does not have a family history of hypertension, remember we talked about modifiable and non-modifiable risk factor. There
Hypertension.
are other risk factors that
Yeah.
will pose, a significant risks to an individual. Okay, now let's look at it this way. Um, there's a gun. The barrel is the hereditary factor. Okay, now the trigger may be the lifestyle of the individual, the kind of diet the person consumes, uh, physical inactivity, another environmental factor may play a role and could be the trigger. So that the person have a family history or parents with hypertension does not necessarily mean the person will eventually come down with hypertension. Even if there is no hypertension in the family, a person can as well over time develop hypertension. Thank you.
All right. Thank you, Doc, for
Okay.
that answer. So are there preventive way that any individual, for everyone, that we can, lifestyle, what we can do to prevent hypertension into general, whether you have it in your family, whether it's hereditary, whether your parents have it or not? What are the preventive way measure of hypertension?
Okay, thank you. Now, for the non-modifiable risk factors, we cannot do anything about that. Okay, but the modifiable risk factors, we can actually do something about them. We can change, we can modify to prevent hypertension. Legislate, like I said earlier, against certain processed food or dietary products for consumption. Again, I noticed something last week or so when the FCT minister, was commissioning some road. There was a section of the road that was marked for cycling.
Cycling,
Okay,
yeah.
good. That is a very good initiative. Okay, now you can take your bicycle and ride. Okay, if you can do that, let's say 15 minutes in a day, or if you can do that, let's say an average of 150 minutes, you know, per day, it's good. And interestingly, exercise itself uh, can actually improve one's blood pressure. Okay, it is said that such exercises or physical activity can reduce the systolic blood pressure to about 9 millimeter of mercury, 4 to 9 thereabout. So this is quite significant. Okay. Another thing is um, stopping or advocating for policies that would stop people from smoking. Okay, even
Mm.
though we can make laws, sometimes we really cannot, you know, enforce it. Okay, on our own, despite the fact that it is written boldly on cigarette pack that smokers are
We are
likely
liable
to
to die young,
liable to die young when they smoke. People still smoke. Okay,
of course.
now
Yeah.
it comes with its own attendant complications. Okay, again, we can try to lose weight when we're obese. When we lose at least about 10 kilogram weight, it's very, very significant. And that in itself reduces the blood pressure between 5 to 20 millimeter of mercury. So it's again quite significant. Okay. Um, we can also uh, advocate for people to eat healthy, for people to measure their blood pressure and monitor their blood pressure at homes. There are devices that one can use to actually measure the blood pressure at home or even while on activity. Okay, and that would improve our blood pressure control and also help us monitor the blood pressure before something bad happens. Again, we can also limit our intake of salt, like I said earlier on, about 5 grams per day. Of course, we have to factor in what we eat, what we drink, okay, to a level that is not beyond 5 grams. And 5 grams, we can equate that to, 1 level teaspoon of salt. So that would be a guide to actually help us uh, control blood pressure. Thank you.
All right. Thank you, Doc. If someone has hypertension, what are the treatments that can be given to such person? Is there a particular treatment or is a particular medication, or what are the treatments of hypertension?
Okay, thank you for that interesting question. When we talk of treatment, we don't only refer to drugs. Okay, there are non-drug treatment and also the drug treatment, which is pharmacologic and non-pharmacologic treatment. Okay, now all we've been doing or we've been saying constitutes or fall under the non-pharmacologic methods. Okay, check your blood pressure, monitor your blood pressure, eat healthy, don't sit without doing any exercise, ensure you reduce your salt intake, ensure you avoid eating red meat, ensure you modify your diet as much as possible to low fat diet or uh, low caloric diet as much as possible, and then take a lot of vegetables, whole grains, reduce high fat dairy products, eat fish instead. Okay, take beans and nuts. This would go in a long way trying to uh, help us treat hypertension. Okay.
Hypertension.
Then, having said that, there are drugs that we use to control hypertension. There are many of them, and they are usually classed. Okay, we have drugs that will try to make a person urinate more to reduce the volume of fluid in the blood vessel. We have drugs that will try to dilate or expand the blood vessel so that the pressure is reduced. We have drugs that will try to control some modulators, in the blood vessels and also in the brain to control hypertension. Okay, there are drugs that will also help or work on the kidneys to modify its work to allow a lot of salt and water pass and then absorb the little um, elements that should be beneficial for an individual. Okay, all these are done in a way to reduce so much pressure to the heart and also the blood vessels. Okay, if the blood pressure is so high, the kidneys can be affected because blood will not reach the kidneys well. The brain can be affected. The heart itself that pumps the blood can also be affected. Okay, so there are many drugs. It wouldn't be right for me to begin to call uh,
Of course.
certain drug names,
Yeah.
uh, products, yeah, for obvious reasons. But there are a lot of drugs for hypertension. Thank you.
All right. Thank you, Doc. Thank you for that answer. So I would like to know, sir, what lifestyle changes should someone with hypertension adopt?
Okay. Lifestyle changes are many. We've spoken about some earlier.
Yes.
Like we said, it is important that we reduce our weight. If one is overweight, usually calculated by
BMI.
measuring the weight of the individual divide by the square of the height, it gives us is an it's a measure of how overweight an individual is or how obese an individual is. So if we're able to reduce our weight if overweight or obese by 10 kilograms, it is quite significant and can reduce the blood pressure by up to 20 millimeter of mercury. Okay. Um, uh, ensure that we have diets or we eat diets that can stop hypertension. Not directly, by eating to, stop the hypertension, but it it tries to limit our risks of having, hypertension. A lot of vegetables, fruits, whole grains, like I mentioned earlier, okay, low fat dairy products, fish instead of red meat. Um, it's important to state here that some people would eat the intestines, or they go for intestine in the name that it is not red meat. Any meat, whether it's intestine or whatever, um an
From
animal,
beef, car.
from beef or cow, any four-legged animal, like my teacher always say, except
Okay.
rabbit, it's a red meat. Okay, so think of any animal that is four-legged apart from rabbit.
Both the
It
intestine and the
both the
outside.
intestine,
Doesn't
both the
matter.
cow tail, both the whatever cow
Okay.
leg or whatever, it's red meat. Okay.
Out of the
Now
skin.
the skin, well, some say skin doesn't really, have much, but of course there are a lot of fats to it as well.
Yeah.
Okay. So it may not necessarily be very healthy like that. Okay. We should
Yeah.
also limit our salt intake. Okay, avoid sugary processed foods. We should also avoid fatty meats, full fat dairy products, and other processed food. When we avoid this, our blood pressure can actually be reduced by 6 to 14 millimeter of mercury. Again, that is quite significant. Okay, so sometimes we combine both the pharmacologic and the non-pharmacologic methods. In fact, every hypertensive patient must have some uh, these dietary modifications and this non-pharmacologic treatment, including the drugs we would give to control the blood pressure, because it is not only the diets or the lifestyle modification alone that can actually control the blood pressure. Sometimes the drug treatment or medicine actually would be it needs to be instituted. Okay. Reduce salt intake, increase physical activity. So this, in my opinion, I think would be things to adopt as lifestyle changes for somebody or an individual who is at risk or who has hypertension. Thank you.
All right. Thank you so much, Doc. So, as it is, we're coming to the end of the session briefly. Please, for our viewers, please, if you have any questions you'd like to ask us, please drop them in the comments option. From whichever of the platform you're watching us from. Okay, so Doc, I would like to ask, in your opinion, what is the role of care providers in the treatment and prevention of hypertension? So,
Oh, great. There are so many roles. Okay. Being a family physician, there are a lot of things we can do in order to treat and also prevent hypertension. Uh, this particular forum provides an avenue for us to help educate people and also tell people on how to take care of their health, what they can do to promote their own health. Okay. Uh, again, what they can do to also prevent hypertension, or even if they have hypertension, what they can do to prevent complications from setting in. Okay, it is important that, excuse me, please, lifestyle modifications are enhanced. Okay, we encourage patients to adopt a healthy lifestyle, including their balanced diet, regular exercise, weight management, and also reduce their stress. Okay, we also need to, as family physician, emphasize adherence of medication for hypertension. Many times, patients either forget or they get tired of taking their drugs. Okay, because once a person has hypertension, treatment is for life. It is a chronic disease, meaning one will continue to have diseases for a very long time. Okay, um, therefore, it is important that we keep uh, advocating and advising and also counseling patients to adhere to their drugs. Sometimes they may need people around them to help. Sometimes they may need to set alarms, or um, probably have short hospital visits in order to ensure that they are taking their medications appropriately. Okay. Again, educating the patients provide clear and concise information. Okay, about hypertension, its risk factors, the importance of treating hypertension, how to also measure their blood pressures. Okay, at home using their devices, and then in treatment plans, we have to individualize the patient. Okay, personalized treatment plans are developed for each patient, considering their peculiarities, their histories, their risk factors, their preferences as well. Okay, one drug may not be uh, suitable for a patient, while it is for another patient. Okay, um, I will give an example with one of the types of drugs. Okay, um, the angiotensin converting enzyme inhibitors can make somebody cough, a dry cough, while at the same time some another person may take it and then he doesn't experience cough. So these are some of the individual peculiarities, and when we see them, we try to modify. Okay, again, we can collaborate with other healthcare providers. um, it is not only the family physicians that manage the patients with hypertension. Okay, we work closely with other healthcare professionals, dietitians, pharmacists, psychologists, the cardiologists, the nephrologists, and the neurologists. Okay, especially when there are complications or there are issues that relate to certain areas that we need some specialist care. So it is a multidisciplinary approach that we always you know uh, uh, undertake. Okay, we also advocate for regular follow-ups. When a patient has scheduled visit, needs that patient needs to honor that appointment. So those kind of appointments, we assess the patient's progress, we address any concerns, we also make necessary adjustments to their treatment plans, okay, if necessary, okay. It is important to recall also that professionals' advice is important, okay. Sometimes some of these individuals would want to go, and practice what they hear on the street. Take this bobo niche, or take this particular drug. This one would do this, would do that. At the end of the day, they come with complications. They abandon their drugs, they come with complications. So it is important to always educate, and counsel these particular patients. Okay. Um, Again, we coordinate care. Okay, when a patient comes, uh, we try to triage and see if this is what we handle at our own level. We handle. If we believe that this patient would benefit from a specialty care, we refer. Okay, and then we continue to provide continuous care until this patient is 6 feet down the ground. Okay, so we manage patients from the cradle to the grave. Okay, we also advocate for these patients. We do health advocacy. Okay, those policies I mentioned about, it's in our purview to raise issues of concern to uh, government agencies or lawmakers to enact laws that would benefit the individuals or citizens of the country. So these are some of the uh, roles, in my opinion, that we play to ensure people with hypertension are treated, and those without hypertension or those with risk factors for hypertension taken care of. Thank you.
All right. Thank you so much, Doc, for educating us today so much about what hypertension is, how to prevent hypertension, and for those that already have hypertension, how to manage it. For those that are, hereditary, they have people in their family that have hypertension, how to prevent it and how to manage it as well. So before we proceed, we're gradually coming to an end of today's live video. So I would like to us to know that this live video today is brought to us by Complete Care. Complete Care is a digital health marketplace that connects doctors, patients together, and other health professionals in the shortest time possible. So now I would like to ask Doctor, please, in your opinion, I would like to ask, what kind of support does an hypertensive patient need from their friends or their families?
Okay, thank you for this question. It is important again to reiterate the support of people with hypertension, okay, that need to have. Social or family support is very, very important, okay. One may not have his family close by, but his friends. Okay, one may actually have his family close by, and then they can also offer help. Okay, it is important that those with hypertension, okay, would those with hypertension actually have um, people that will show some kind of empathy and support them. Okay, support can come in different forms. It can be support in reminding you or an individual about his hospital visitation, about his drugs, or monitor the intake of such medication. Support can come in form of trying to um, keep an itinerary of events for the person, especially if, let's say, an elderly person is the one that is hypertensive. One can just draw up, a list of activities, especially including the hospital visitation, the types of drugs, what drug he's taking, when he's supposed to take his drugs, when the drugs are exhausted, and when he needs a refill. This will go a long way in helping, an individual. Okay. Again, it is important to provide emotional support, be positive, and also encourage them about how they can take charge of their own health. Okay. Um, Try to show love and empathy to these individuals, and provide that. supportive environment. Again, there's also spiritual support. We know we are spiritual people in this part of the world. Okay, um, there's the role it plays in our healthcare. Okay, sometimes, frequently people say that what you believe works for you. Okay, if I have faith that this will help me, why don't I go into it? Yes, there's a place of faith in healthcare as well. Okay, and healing. So these and many others options would actually go a long way in supporting those with hypertension. Self care is very, very important. When we are encouraged to take ownership of our own health and also to ensure that we continue to have uh, or continue to adhere to our drugs, it goes a long way. Many of those who actually uh, have stroke is either they were hypertensive and didn't take their drugs, or at all they were not even hypertensive, but due to some reasons they had some risk factors that were not taken care of, they have stroke. Okay, so medication adherence is very, very important. Okay, when we ensure that we exercise and we don't sit in one place, even for the elderly, strolling, walking briskly, or gardening around the house are some of the forms of exercise that could help. All right. So when we also take care of our health by ensuring that we have a device at home to also measure our blood pressure, and then have a book that we record, so that when we go to the hospital and then compare what the doctor is blood pressure check is versus what we have on our it's on our own records, it goes a long way. So self-care is very, very important. So these are the few I have to say on that. Thank you very much.
Thank you so much, Doc, for that extensive answer. Please, for our viewers, please, if you have any questions, the floor is open now. Please send in your questions if you have any questions for Dr. Mashak right here. And please, I know we've listened to Doc explaining to us over some minutes now what hypertension is all about, how we can prevent hypertension, how we can manage it as well. Please send in your questions to our viewers. You can drop your questions. You can drop your questions. And before we go, Dr. Mashak, please, you can please give us one last advice. What advice would you like to give to everyone watching us right now, or that would eventually watch this video? What advice would you like to give everyone of us?
Okay. Um, to everyone watching this and to our viewers across the world, it is important that we check our blood pressures. If you don't know your blood pressure, try as much as possible to have it checked. You may be surprised your blood pressure is not normal as you think. Okay. Um, Again, we should also advise and educate people around us with hypertension or with risks for hypertension. It goes a long way in trying to stimulate us to be self conscious and self aware that there is a condition like this. So, if we check our blood pressure regularly, it will save us from dying early. So, thank you very much.
Thank you. Thank you so much, Dr. Mashak. To round up the session, I would like to let us know once more that this live video is brought to us by Complete Care. Complete Care is a digital health marketplace that connects patients with doctors and other healthcare professionals within the shortest time possible. Complete Care is your surest, convenient quality healthcare plug. Please, thank you so much to our viewers for joining us this evening. So for this evening, we spoke about hypertension, and Dr. Mashak has explained to us extensively what hypertension is all about, how to prevent hypertension, and how to manage hypertension. Like he said, please make sure you check your blood pressure. You might be surprised what your blood pressure is. So please, let's constantly check our blood pressure. Let's eat right. Let's live a good lifestyle, exercise, like our doctor has said, so we can live longer, we can be healthier as well. So thank you very much once more to everyone joining us on all our social platform this evening. See you next time on our next live video. Thank you and have a good night rest. Bye everyone.
Thank you.